Welcome to the Aging Well podcast, where we explore the keys to living a healthier, longer, and more fulfilling life. Today, we are thrilled to have Dr. Nami Patel join us. Dr. Patel is a trailblazer in the dental industry, a functional and holistic dentist passionate about transforming oral care into a gateway for overall health. As a leader in green dentistry, she integrates eco-conscious practices into her innovative approach to patient care. Dr. Patel is not just a practitioner, but also an educator, author of Age with Style, and a philanthropist serving over 3,000 villagers in India annually through her nonprofit work. In this episode, we'll discover how maintaining healthy teeth can extend your life, the link between oral health and preventing diseases like Alzheimer's, heart disease, and diabetes, and even how to address conditions like sleep apnea and TMJ without a CPAP machine. Let's dive into the fascinating connection between your mouth, longevity, and aging well. Dr. Patel, welcome to the Aging Well podcast. Let's have you just start by telling our viewers and our listeners a little bit about yourself and how you became passionate about holistic dentistry.
Oh, thank you so much, Jeff. I'm delighted to be here. Thank you for having me. I love sharing this story because I feel like dentistry found me, and, a lot of things that kind of were mishaps in life it kind of like as destinies kind of put me into holistic dentistry and functional dentistry and really looking at how do we help patients. So believe it or not, I thought that looking in the mouth was disgusting. I did not want to do that. I was like, ew, gross, I was actually going to be a neurologist. I wanted to be actually a neurosurgeon, actually, to be exact. So I had gone through my schooling. I was actually in a school where they had a pre-dental program and they had a pre-medical program. I was in the pre-medical program, but of course, our science classes overlapped with the dental students. So one of my friend who was my organic chemistry partner it was a summertime. I wanted to get organic chemistry done. Wasn't the best, I wasn't the best in it. And I was just like, oh my God, I'm really suffering through this class. And so my friend was really, really, really helpful. She was a pre-dental student. And so we were doing classes together and things like that. And then she was volunteering at this nonprofit government clinic in like Central California. And so it was about an hour from college. And I was like, oh, she's like, will you help? They're really in need of help. And I was like, okay, well, what am I going to do? Hold a suction tip, whatever. So I went and I really started enjoying the people interaction. And I mean, the first time I went there, I didn't feel like I was helpful. And then I went, but I felt good because I felt like I was helping, and then the next time she asked me again. So I went again, and then I went again. And then it just turned out that the people remembered you, and that was really awesome. And it really touched me in so many ways because they would bring they were farm workers, they would bring almonds or, oranges, whatever they picked in the farms as a little thank you. And that sense of community, that sense of connection was really lovely. I just kind of fell in love with it. And so, I kind of let go of neurology and then went into dentistry. And then I decided to apply for schools. And believe it or not, they lost my DAT scores. So I was supposed to go to UOP, but I ended up going to USC because they lost my DAT scores. And by the time my DAT scores were released, it was literally a month before school was going to start. Dental school was going to start. UOP was like, hey, we're full. We can't take you. If you wait a year, we'd love to have you. But USC was like, oh my God, we want you. You can get started right away. And I was like, I'm coming. So when I got to USC, it was really great because it was the first program that was problem-based learning, so evidence-based learning. So the program was designed to be, it's not regular pedagogy where you sit and you just listen and there's a lecture. This was all about you actually had to research, you actually had to do homework, you actually had to be engaged. So for example, my first case was hey, Mrs. Richardson is 52 years old. She comes in and she complains of trouble swallowing. Has nothing to do with a cavity, has nothing to do with gum disease, but it was really about she has a problem. How would you approach her? So we started thinking more like a medical model, right? And a functional health model, looking at root causes. What is the reason why she can't swallow? Is it that, she might have dry mouth? Could it be that she has an autoimmune condition? Could it be that she has some sort of other condition that, stops her from swallowing? Then they give you more information, she actually has regurgitation. So then we start looking at acid reflux. We start looking at hey, so she's having trouble swallowing. She's got acid reflux. Where is that coming from? Is it sleep apnea? Or is it that her esophageal sphincters aren't working? Or is it her tongue tie that she might have? So we really started looking at root causes. And that was the best thing that's ever happened to me. My DAT just scored stuck and I scored in like the 90th, 7th percentile. So I was like, hey guys, what's happening? But I feel like the universe had a plan. And so I ended up, graduating and I come from an Ayurvedic background. Of course, I'm East Indian. I come from a mindfulness background as well. So it was like the perfect, just everything kind of happened for the right reasons. As much as I was so upset about it at that time, everything happened for a reason. And when I started, when I got out, I wanted to make a difference. And I was like, I don't want to be like every other dentist that's out there. I really want to look at root causes. I really want to be part of the solution instead of just like drill and fill this little circle. I really wanted to look at how do I get these people like independent? How can I empower them so that they're able to live long, look good, feel good, chew comfortably, and not just their mouth, but really their overall health? Because the mouth is part of the entire body as well. And in Ayurveda, we actually look at the tongue and use it as diagnosis, right? So I really wanted to have more value with, dentistry, because I feel like dentistry has been a stepchild of medicine for a very long time. And it's actually one of the most important things that we need to look at because number one, our microbiome, is part of like our saliva is our microbiome. We swallow 5 pounds of bacteria every single day. And that is so important because our gut is our immune health. Our microbiome is our immune health. So really giving that importance. The second is that dentistry, like the upper and the lower arches, are very important because right on top of the upper arch is your functional airway. So being able to breathe through the nose, which creates nitric oxide. Nitric oxide, naturally, your body naturally does this, helps you fight heart attack, diabetes, cancer, Alzheimer's, all of these things. And again, a critical part of your immune system and your cardiovascular health. So, it's been really awesome. The journey's been really great. It's been a lot up and down, but, it's been an amazing journey. And, I feel so thrilled and so excited to be able to help patients on a regular basis. This is my way of life. And I say this to my patients, Jeff. It's so funny. I would do this if you didn't pay me. I do not encourage that, though. Do it because I love it so much. Yeah. Because it has a massive impact.
Well, let's keep this conversation going. What is green dentistry? And how does it differ from different traditional dental practices?
Awesome. Well, that's a great question. So green dentistry is, I call it green because it's eco-friendly and holistic. Eco-friendly meaning that all the materials we use are non-toxic or the least toxic that we can find in the dental industry. Also, like the way our office is designed, it's LEED certified. So we did this 20 years ago. We're the first LEED certified office in the state of California and second in the nation. And really setting this trend because medicine and dentistry have known to be so wasteful. And so I wanted to create an environment, especially with people with a lot of allergies, a lot of breathing problems, and really create an environment where it was clean. It's mold free. We're obviously metal free. It's just really a great way to create a beautiful environment. It's feng shuied, a beautiful space where people can come in for dental work. And that's one aspect of it. But really the root or the most important aspect of green dentistry is that we are a combination of metal-free, mercury-free, biological, holistic, functional dentistry. I combine an Ayurvedic, I combine all of that together because I have background in all of that. And what I like to do is customize the care for my patient. For example, if you came in and your concern was, hey, Dr. Patel, I have a lot of gut issues and I don't know why. I don't know what's happening. Can you help me out? I feel like I grind my teeth all the time. So what I would be doing would be, number one, I would want to make sure you don't have any toxins in your body, root canals, if there's any low-grade infection, because low-grade infections are actually the worst. Active gum disease is actually the worst because it's like, if you got sick, I'd rather you get sick for 7 to 10 days and your body recovers. You're going to build immune cells around it. It's the low-grade infection where those root canals are reinfected or infected for a long, long time, or gum disease that's been sitting for a long, long, long time. You're swallowing those bugs every single day. Your immune system is hyperactive. It doesn't get a chance to rest because then it can't focus on rebuilding. So what I would be looking at is not just, hey, your gut, but let me look at what are all the things are there. I want to make sure there's no amalgams. I want to make sure there's no root canals that have failed. I want to look at your functional airway. I want to look at your vitamin D levels because vitamin D is super important. Vitamin D is part of all your hormones in order to make you work well, right? Your body, the hormones are needed because they're traffic signals and it tells your body to fix itself. I would want to make sure that everything is in alignment. So that's the reason I call it green dentistry, because it's not just biological, it's not just holistic. We follow so many different, from Hal Huggins to Dr. McCullough, Dale Bonine Institute to prevent heart attacks, Apollo Health to prevent Alzheimer's, just a lot of different, groups that are out there that have really good information that's data driven and really utilized for the patient. So it's because most dentists say, oh, I'm holistic because I don't place mercury fillings. And it's not about that. It's beyond the mercury fillings because we now know more. 50 years ago, sure, that was the only thing we knew. But nowadays we know so much more and we can test it. We can test specific bacteria that cause heart attack, diabetes, cancer, Alzheimer's, all of that stuff. We can test for mycotoxins. We can test for metal toxins. So we can test for a lot of these things, do the work, and then retest it to make sure that there's that confidence in health, because that's what we really need is that confidence in health.
Yeah, it's amazing that, and we just learned this recently, I think it was one of our guests toward the end of last season mentioned how they really just banned mercury in fillings. I mean, how is that possible that they took so long? It'd be wonderful if we didn't have to put green in front of dentistry or medicine or any of that kind of stuff. And it, even in the medicine approach, took a more holistic, let's get to the root of the problem kind of source. And so can you share a little bit about how sustainability influences a little bit more? I mean, you've already alluded to this a bit, but how sustainability influences the techniques and the materials that you use. I mean, obviously you're not using mercury, but what other materials do you use that would be considered sustainable?
Absolutely. So when we look at sustainable materials, hands down, no mercury, of course, right? But also no metals. We're finding that, especially with EMFs, that metal toxicity is going up. And especially because now we're living longer, right? Before people died at 60, so it was like no big deal, like whatever. But now that we're living till 100, 120, and especially with a lot of regenerative medicine, we're going to live a lot longer than that. So we really everything boils down to inflammation, right? So everything is like the way we, die is really inflammation. It's either low-grade inflammation or high-grade inflammation. Low-grade inflammation, we talked about infected root canals, or things that cause your immune system to be active all the time. And that's your low-grade infection. High-grade infection would be like a fever or something along those lines where your body can recover pretty quickly. Now, those low-grade infections over a long period of time, they really occupy the body's reserves. So as it is occupying the body's reserves, it's spending time fighting bacteria, viruses, anything like that. And what actually happens is those toxins start developing or being stored in the cells, whether it's, from a mercury, you can get, mercury vapor that gets bound in those fatty cells of the brain, a lot of times in the liver. You can also get mycotoxins, which is really huge. And then the other thing that we really need to start talking about is pollution. Pollution is one of the things that is not discussed at all. And we just kind of think it's normal or it's just in China or in India because, they're third world countries or second world countries. But really, we all share the same air. So everything that's being released there is being, coming into our air here. And it's one of the biggest risk factors there is. And that's one of the reasons when we talked about green dentistry, we actually have a filtration in the office. So that way it's clean air. And we have air doctors sitting in the office. The way that the office is designed, it's unilateral circulation. So the air doesn't circulate in a circle. It starts from one area and gets suctioned on the other side. So it's a clean environment. So putting all those things together are some basics. And then when it comes to specifically to dentistry, I don't like when we do cleanings and things like that, we use ozonated water, which is really great, right? We also make sure that we're using lasers instead of antibiotics. Even mouthwashes that we're utilizing are made with like chloride ions versus all this toxic stuff that people are using. And then when we're using like fillings and stuff, we have bisphenol-free fillings so that we're actually making sure that there's no cancer-causing agent in there. And then even with like crowns, we do 3D milling. So we actually have biocompatible restorations. So the restorations are really great because they don't cause any sort of reaction in the body. It's inert. So there's things that cause an inflammatory response. There's things that don't cause any sort of response. And that's the stuff that I like to use it doesn't cause any sort of response in your immune system at all. So it's not active, which is awesome. When it comes to, we obviously have zirconia, which is great too. But my preference is to use the least toxic material that there is. And the most important one, really, in honesty, is prevention, 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 prevention. There are certain things that happen at certain stages of our lives, like in the teenage years, there's going to be a lot. Well, let's start with babies. With babies, we're going to start looking at tongue ties. We're going to start looking at making sure they're breastfed so their palates develop properly. They're not having baby bile decay. As the kids get older, we're wanting to make sure they're breathing through their nose, making sure that they're not having adenoids, also not eating a bunch of crackers, things that cause cavities and all that stuff. As they get into teenage years, the hormones start raging. So we really need to make sure that they're hormoning, they're okay, because that does make bacteria overgrow. So we're catching them then, and then 20s and 30s are usually okay. And then usually 40s is when sleep apnea starts showing up. Or upper airway resistance starts showing up. So those are things that we start really needing to look at. And then 50s and 60s, we start seeing dry mouth. And dry mouth is a precursor to, so many different problems. Earlier I talked about all these bacteria that develop. These bacteria are developing because the dry mouth actually creates a perfect brewing ground for bacteria to overgrow, especially the ones that cause heart attack, cancer, diabetes, Alzheimer's, and arthritis. That's what we're talking about. And the other thing is that most people are thinking about dry mouth, even in younger ages. A lot of people are on anti-anxiety medications or are vaping, right? All those things are going to create a dry environment, which make all these bugs overgrow. So we really look at how do we prevent that and how do we put patients on a regimen so that they can avoid problems. And that's what makes sustainability is the prevention piece. I mean, I always say prevention is better than the cure, right? The cure is costly, it's painful, and it is no fun versus prevention.
Are you saying dry mouth is linked to anxiety?
Actually, what I was saying is that anxiety medications will cause dry mouth.
Gotcha. Okay. Because
they're anticholinergic. So what that does is your salivary glands need neurotransmitters to actually output saliva. So that when there's anti-anxiety medications, they're actually occupying the receptors so that people actually end up getting dry mouth. Some of them even cause grinding. Some medications even cause grinding. The other medication that's really prominent for dry mouth is high blood pressure medication.
Man.
And people are on it all the time, right?
And they take it to cure one thing, and then it has a snowball effect to cause other issues. It's crazy.
And the sad thing is, and we had a physician that we interviewed recently that, made the comment that drugs have never cured anything because you get on the drug and you're on it for life and you never come off of it. Whereas, if we take that more holistic, get to the source of the problem, and whether it's coming from your dentist or your physician, you're solving more than just the immediate problem.
Yeah, getting to the root, like you said, getting to the root.
No pun intended.
Yeah.
Right?
Yeah. Which is a dentist, yes.
Okay, so what are some of the most surprising ways that oral health impacts the rest of the body?
The most surprising ways, I feel like people always forget I'm glad that we're talking about the dry mouth, which is really huge. I feel like that is really something that people don't really talk about. Other surprising
when you
ways.
mentioned the nitric oxide,
I was just going to say that.
I was like, what? That's crazy.
It's really, there are certain things that people just didn't put together for a long, long, long time. So, the perfect example is braces. People think every kid should get braces because they want them to look good, right? But what's happening is that these kids are developing functional airway issues and not getting the nitric oxide. The reason is the air should go through the nose to the back of the throat and back down. Now, if you're a child and you're growing, right? And then if we put braces on the teeth and jam the upper and the lower jaw together or in a specific format, it won't allow the rest of the body to grow. So it doesn't allow the brain to grow properly. It doesn't allow the bones to grow properly. And it definitely doesn't allow your sinuses to grow. Because if you look in the mirror, right on top of your upper arch is your nose. And that's where the nitric oxide is created. That's one piece. Now, second, out of your lower jaw, if you look on the side, this is your functional airway. This is your windpipe right over here. So when there's a narrow jaw, there's a smaller windpipe. So now these children or these adults now actually have something called upper airway resistance. So instead of breathing through their mouth like they're supposed to, they're going or snoring, breathing through their mouth. And if you notice, a lot of times when you're talking to people, you'll see their mouths open. And we will see that the tongue doesn't have enough space, that functional airway is disturbed. So that is something that people don't really think about. They think, oh, this is normal, or, they're not really thinking that the braces has a massive impact on the rest of the body. Now, these patients over a period of time, I'm going to see gut issues with, I'm going to see ADHD, I'm going to see anxiety, I'm going to see acid reflux. These are some common things that we see on patients when they've gone through a round of braces when they were younger and have had their, jaw restricted as they're growing.
Wow. So how can maintaining a healthy oral microbiome reduce some of the risks of some of the more systemic diseases like diabetes and heart disease?
So one of the things we now know is that there's specific bacteria that overgrow. Some of it is going to overgrow if you're not brushing and flossing, of course, right? But beyond that, there's a lot of risk factors. Pregnancy is one, dry mouth is one, anxiety medications are one, high blood pressure medications are one. So what do those things do is that they make the bacteria, like they create the perfect brewing ground for bacteria to overgrow. When this bacteria overgrows, you swallow 5 pounds of bacteria every single day. If you do it for, these bad bugs are in your mouth for like, let's say a month or two, no big deal. Your body can probably process it. Now you let those bacteria overgrow for, let's say year and a half, 2 years, 3 years, 4 years, 5 years. And then on top of that, we're getting older, right? So we have all these toxins from our food, we have toxins from the air. We have all these toxins that are kind of building up in our organs and they're not functioning as well as they should. What happens with these bugs is that they go into your stomach. From the stomach, they actually break the enteric lining. When they break the enteric lining, they have access to your bloodstream. When they have access to your bloodstream, what happens is your body is like, hey, you're not supposed to be here. Let me attack you. And it does, which is what we want. However, what it does in the bloodstream is it binds to cholesterol. As your body is fighting off the bacteria, the macrophage will go around the bacteria and then it'll start binding to cholesterol. As it binds to cholesterol, it starts occluding the arteries, and that's what we know as heart attacks. Now,
plaque.
Yeah, exactly. Plaque buildup. Okay. Yes, over and hardened plaque, because it releases something called tumor necrosis factor alpha. So what it does is the elasticity of our vessels become hardened. So you hear patients having open heart surgery or stents or something along those lines. That's what we're talking about, and those bacteria are actually coming from the mouth, right? So that's one. The second is, as a bacteria, we now know that there's associations between certain viruses and certain cancers. So what happens with these specific bacteria is that they actually are linked to increased risk of cancer and tumors because there's a direct correlation. And in specific with diabetes, what these bacteria do, they specifically attack the beta cells. These beta cells are attacked by the bacteria and they lead to uncontrolled growth. And that's how it leads to diabetes. That's one path. The second path is that these bacteria are overgrowing, but your body has to fight them off. So it needs ATP, it needs sugar, right? So it's going to create that insulin resistance as well. So that's how they're related to diabetes. When we look at Alzheimer's and arthritis, so, we all know about COVID. It was, not something we ever want to go through again. But the reason we all went through COVID is because COVID passed through our defenses. The virus was so small that it passed through our defenses. Normally, if something is 0.2 microns, our nose filters it out. Now, COVID was like 0.1 micron. That's why it went through our system. The same things with these bacteria. There's some of them that are so small, they can actually bypass that blood-brain barrier. And it gets into the brain, and that's what we call Alzheimer's, right? Because your body attacks it. As a body attacks it, it actually gets rid of good, healthy tissue as well. And over a period of time, there's a lot of damage that it can't repair anymore. And that's what leads to Alzheimer's and dementia. And then when it goes into the joints, we call that arthritis. Does that make sense?
Yeah. So overall, floss is what I'm hearing. It's important.
More than that.
We definitely want to floss. I feel like that's one thing that we definitely want to floss. Floss, brush your teeth, of course. Tongue scrape is another. but visit the dentist more regularly, right? Let's visit the dentist more regularly. Let's also mouth tape so that the mouth isn't dry while we're sleeping. Let's make sure that the measures are taken into account. So what are some things that we can do for good mental health so we don't have to be on medications? But just really changing that mindset into more proactive, preventative health versus like, oh, I can pop a pill. Because if somebody has a headache, they're going to reach for that aspirin versus like, hey, maybe let me take 15 minutes and meditate for a second. Or did I hydrate enough? Let me have some water.
Yeah, I was going to say, it sounds like hydration is more important than just getting the fluid to the tissue. It's that whole cleansing process of regularly just flushing the mouth.
Yes, exactly. And
so I have to drink more water.
Yes. We're 90% water, so definitely need a lot more water for sure.
Okay, so I'm going to get a little personal since we talked about sleep apnea. I actually have sleep apnea, and I went in, I did some testing, and this is in my mid-20s, and I got diagnosed with sleep apnea. Now, I was in a lot better shape back then, and they said it's because I have such a big head that my neck muscles, when I relax, they collapse on each other. But it seems like there's a lot more factors than that. So I guess many people also struggle with sleep apnea and rely on that CPAP machine. How do you help your patients address the conditions naturally?
So the first thing we would do, and sleep apnea is very common. My suspicion is you went through braces.
Okay, so I did have braces, but like my top teeth were always straight. So my top teeth were always straight. My bottom teeth were more crooked, and I'll be honest, I never wore the retainer, and now my bottom teeth are back to being crooked on the bottom.
Well, hey, leave them crooked, first of all, is what I'm going to say, is because your tongue doesn't have enough space. That's exactly what happened. Remember earlier we talked about the tongue not having enough space. So when we talk about the functional airway, we want the sinuses to be open. We also want the tongue to have enough space. So when we say obstructive sleep apnea, it's actually an obstruction. What it's saying is that the tongue is falling back. The reason the tongue falls back is because it can't create a latch or suction. And so what happens in this part, or the lower part of the jaw, that tongue falls back and it stops you from breathing. And that's what we call obstructive sleep apnea. Now, as a dentist, I can correct this. And we actually take a lot of patients off of their CPAP machines for life.
All right, talk to me.
So the first thing I would do is I would take a sleep study CT scan, figure out exactly where the problem is. Is the problem in the sinuses? Is the problem in the tongue? Or is the problem in your windpipe? Or is it problem everywhere? In majority of the patients who have sleep apnea issues also have ringing in the ears or TMJ pain as well, because and grinding, right? So the reason why they're having that is because your body is naturally trying to keep you alive. Oxygen is the one thing we can't live without. It's not really interested in nitric oxide. It's interested in oxygen. We are interested in nitric oxide for a health reason. So if you can't breathe through your nose, it's going to start automatically scudding you breathing through the mouth. And so a lot of times if patients have weight gain, if they go through, aging causes as the tongue muscle starts collapsing, it doesn't have enough space is what actually occurs. So we have to go back and undo that. So we can actually train the tongue to become stronger by myofunctional therapy, which is tongue training exercises. It's been studied by Stanford. It has been studied by so many different organizations. It works so well and it gives immediate results. So tongue is a muscle. Just like we go to the gym and work our muscles out and get really nice biceps, we have to do the same thing to our tongue. And we have to do it even more now because we're living longer. At 40, the tongue muscles really relax. Your problem started earlier because my suspicion is the braces, or if you were not breastfed, and some of it is also genetic and evolutionary too. So I can talk more about that in a second as far as where it stem from. But the root, what we do is that the treatment aspect is still the same, whether it came from genetics or evolution or, whatnot. We figure out what the problem is and we treat it in that manner. So first thing could be, myofunctional therapy. The second is actually opening the upper and the lower jaw. Like you said, your teeth crowded is because your tongue doesn't have enough space. It needs more space. The way we would do that is we have appliances that you wear just at night, which is really awesome. And what they do is we now know the frequency of bone making cells. in your palate. So what we do is retell those bone to make more bone. So you go from a palate that's this size and we make it wider. And as it becomes wider, there's more space for the tongue. And when there's more space for the tongue can latch. And that's when we're able to create the proper function. Form and function go together, right? So we create the proper form and we create the proper function so that it gets you off of the CPAP for a lifetime.
That's fascinating because I'm actually in the process. I have a sleep study. Of course, I can't get into the doctor until March, but I have it scheduled just because I'm not sleeping quite as well as I would like to and not having good restorative sleep. Sure. And so, like yourself, I want to go to the root of the problem, not, dealing with the symptoms of the issues. Right. And so it sounds like, there are far better pathways than, going and just taking the CPAP machine. And you say that TMJ is also a common issue. Mm-hmm. What are some non-invasive treatments that you recommend for this?
For TMJ, it depends on how severe it is. But a lot of times the appliances that we utilize, we can fix TMJ and airway at the same time, which is awesome. And that's what we like to do. There's orthotics or different splints that we use for TMJ. If a person just has TMJ and headaches, but no sleep apnea, we have different orthotics that we can utilize. And depending on where the problem is, because they may just have a TMJ issue, but their root is probably the sinus, if their sinuses are blocked. And so depending on where the problem is, we have different appliances that we can customize the care so that we're really honed in on the problem and really resolving it.
Yeah, I'm really interested in this expanding your palate and getting off of CPAP because that would be amazing.
Yeah.
So, I'll have to look more into that.
Yeah, well, come on over. We'll take good care of you. The other thing I was going to say that's an immediate release for patients is also laser therapy. We can actually utilize laser therapy. Remember I told you about the exercising the tongue? Mm-hmm. So sometimes what happens is we have to exercise the tongue, but we can also shrink the tongue. The way that we do that is through a laser. And so what we do is, women do this all the time. They go in for, a dermatologist and use a laser to tighten up their wrinkles and tighten up their skin, right? We have specific lasers that actually help with the tongue. So what we can actually do is tighten up the tongue muscles and it immediately stops snoring. And it makes a big difference trying to get your nose breathing the proper way. So again, once we get that CT scan, we'll really figure out exactly where the problem is. And we find the most cost-effective, time-effective solution that we can for our patients so that, they can go back to living life and having a good time, going on hikes, spending time with their loved ones, having a good time. So that's what life is all about. We have one life to live and we've got to make it count, right?
Yeah, that's right.
Now, is there such a thing as tongue Botox to shrink the tongue?
It's the opposite of Botox, but yes, it's kind of I would call it tongue laser. It's called neocollagenesis, which means that you make new collagen. So, earlier, and it's wonderful. Science has evolved so much now. So we now know how to create new tongue fibers. And so what we do, just like we do, when we work out and go to the gym, our body's creating muscle, fibers, right? Tightening them up. So the laser actually, the only way you're going to make new collagen is if you fall and there's scar tissue and your body needs to create scar tissue, right? So it'll do that. But now we can induce, your body to make new collagen by setting the right signal. Just like the way we tell your bone-making cells to make more bone, we now know the specific frequency of these things. So we can activate your tongue muscle and we not only just do the tongue, we actually do the soft palate as well. We tell and then the back of the airway, we say, hey, tighten up for us. So we send it the right signal, so it just tightens up.
And I'm curious, you mentioned the exercises for the tongue, and I'm really curious what those might be because I got as an exercise physiologist, I'm thinking you're going to attach some weights to it and do some tongue lifts or something like that, but I'm sure that's not what you're doing.
Well, hey, we do some tongue lifts, but with a spoon. Okay. We do some tongue lifts. So they're simple. So one of the easiest exercise is going to be sticking your tongue out all the way. Yeah, all the way out. Yeah. And see how it stretches the back of the tongue? If you just stick your tongue out, you can try to touch your tip of your nose. That's an exercise as well. This is a tongue taco. You can roll your tongue, and that's called a tongue taco. So those are some simple exercises that can be utilized. The one that I really like is the tongue clicking. Watch. I'm going to start at the roof of the palate. Yeah, you do that 100 times, your tongue, that's a tongue push-up.
Wow. I'll have to start working on that.
Yeah, you know, what's going to be amazing is that I have patients who come in and they're like, you know, I've only done them like 2 or 3 days, but you start feeling the difference so quickly.
So I imagine Gene Simmons isn't one of your patients.
In your book, Age with Style, you emphasize the link between oral health and extending lifespan. Can you explain on how keeping teeth healthy adds years to your life?
Absolutely. So the easiest thing is that keeping your teeth adds an extra 10 years to your life. That's without even checking the microbiome, getting a functional airway, or anything like that. And the main reason is if you have teeth, you can chew. When you chew, you get those leafy greens in. You're able to chew a salad. You're able to get those leafy greens, and those leafy greens are loaded with nitric oxide. That's the reason why salads are so good for us. And that's the reason why salads are good for our health. All those leafy greens make a massive amounts of nitric oxide. So when we're able to chew, we're able to get the nutrients in, and it also allows all of our cellular functions to work. So that's the easiest way and the most important reason to keep your teeth, right? Got to keep your body functioning properly. Now, secondly, if we add more to it, so if we start adding the microbiome, making sure the microbiome is healthy, if we start making sure a functional airway is great, those things are fantastic. Now, we can also add some lifestyle things in, like hydration, really making sure we have enough water. The other things that are really great is detoxification. And we don't focus enough on detoxification. So in anti-aging and really making sure that our telomeres, our DNA, what happens as we get older, the reason why we get older is because our DNA is rounded up, right? So as we age, it slowly starts unwinding. So the length of our telomeres become shorter and shorter and shorter. So if we want to keep our telomeres in the proper, or keep them really nice and tight and round, there are certain things that we can do in order to do that. One is intermittent fasting. Intermittent fasting is amazing at helping making sure that our bodies are staying healthy. Now, the other thing is actually sauna or steam room 2 to 3 times a week. It does a world of wonder. Yeah, it detoxifies. Your body detoxifies and keeps that telomere in place. So when you're able to go into a sauna, it gets rid of metal toxins, mycotoxins, all this stuff. And what it does is generates heat and makes your body work differently. And the way that it's more efficient, it allows your body to really, because remember, all of lifespan is inflammation. And when we can detoxify, you lower the amount of inflammation and you increase the body's ability to remove toxins. You just make it more efficient, right? So that steam room and sauna is amazing at doing that. So I'm a big fan of those things. A couple other things that you can do in order to increase lifespan is vitamin D3. What happens as we get older is that our bodies just need more D3. You know, the amount of D3 we needed in our 20s is very different than what we need in our 40s and 50s. As in 60s, 70s, and 80s, as we get older and older and older, the more vitamin D we have. We now know that vitamin D is a precursor to all of our hormones, including testosterone and estrogen and calciferol and all these other things, right? So what really helps is having that D3, again, helps you lower the amount of inflammation that's in your body, which also increases lifespan.
Wow. So I think I try to rinse twice a day, with a Listerine type of mouthwash. Do you have any kind of recommendations for those kind of products and other things that we can do daily to kind of optimize our oral health and our overall health?
Absolutely. The first thing I would say is we got to let the Listerine go because it has alcohol. Okay. It'll mess up your microbiome. So we don't want that. And so, Jeff, the other thing I want to say is that I'm a fan of less is more. So, some of the mouthwash, I'm so glad you brought this up because, mouthwash is actually marketing. It doesn't really do much, right? Unless it's a specific mouthwash for specific reasons. Listerine or something over the counter is just designed for us to feel fresh or feel good. And so I would say the best way to feel good is actually floss first, use an electric toothbrush, brush your teeth, and scrape your tongue. If you are doing those things, your breath will be fresh. You will feel rejuvenated. In fact, if I ever have a bad day, that's the first thing I do is I brush my teeth and I feel so much better, So I feel like it's one of those things that, brushing the teeth and removing the bacteria is actually far more efficient than a mouthwash. If you want something that like, if you're feeling like you're out and about and your mouth is a little dry, I would say use like xylitol gum.
Okay.
So xylitol is a 5-carbon sugar instead of a 6-carbon sugar. So that 5-carbon sugar, the bacteria can't digest it. So it's actually really great. So that's what I would use is xylitol gum is going to be much better. And in fact, there's something called BioGaia has a probiotic. So that's actually really good. It tastes like a breath mint and has good bacteria in there. So I'd rather see you use that versus a mouthwash.
Okay.
So, sorry, go ahead.
Oh, I was going to say the reason I started doing it, twice a day was, during COVID, I came across some research where they talked about how, it was effective in kind of killing the virus if it made it kind of to kind of the upper, part of the oral cavity. And so I just kind of made a habit of that. Is there an alternative to that might be better in terms of killing some of these pathogens that might get into the body?
Yes, absolutely. And much better for you too. So the one that I like is called OraCare, ORACARE. And what it does, there's 2 bottles. You put 1 pump of one and a second pump of the other, and then you let it sit for 30 seconds and it creates a chloride ion. So the reason I like that is when you swish around with your mouth, what it does, it gets into areas and it becomes a gas. So as we know, gases get into areas that liquids can't, right?
Mm-hmm.
Or our toothbrushes can't. So the reason I like the chloride ion is that it increases the surface area that it actually gets to is much higher. And it also kills bacteria. It also rehydrates the mouth. So that's the reason I like OraCare significantly. It is fantastic. In fact, I use it for a lot of my patients. And especially if somebody is older, has dry mouth, cancer therapy, anything like that. It's a wonderful, wonderful, wonderful thing to have.
Thanks for the product advice there.
Absolutely.
I know Listerine is bad, but every now and then I'll use hydrogen peroxide, like every 2 weeks or so, for a really fresh feeling. Should I just stop altogether?
No, it's fine. Actually, as long as you're not doing it every day. So
No.
Here's the thing with the microbiome is when you're doing something like twice daily, it's going to mess the microbiome up. Like if you do it once in a while, it's not necessarily going to have a massive impact, right? So if you, like, for example, the alcohol, the reason I talked about the Listerine is because if you're using it twice a day, that's a lot, right? It's going to continuously get rid of that microbiome balance. I always like to think about the microbiome like a lake or a pond. That's what we want. So we want that to stay the way it is. If we continuously add agents to it, it's going to start changing, the different fishes that come and things like that, right? Or algae is going to overgrow. So that's what we want to do is maintain that balance. The best way to maintain that balance is if you're using hydrogen peroxide once every 2 weeks, not a big deal. And even with the OraCare mouthwash and stuff like that, if you're a general healthy person, I would say use it maybe once or twice a week, and it's fantastic. You don't need it every day. And that's one of the reasons why what we really just need to do is remove the biofilm. The biofilm is just bacteria that overgrows, and we have bacteria everywhere. We have it in our skin, we have it in our clothes, and we have good bacteria and bad bacteria on there. All we want to do is just make sure that good bacteria populate. And that's why brushing and flossing is so great. And that tongue scraping is because you're getting rid of that biofilm. And that's really what we really want. That feeling of freshness is just a feeling, it's from a scientific perspective, does hydrogen peroxide work? The answer is yes. So you just don't need it every day. So once every 2 weeks, it's fine. No worries at all.
Cool.
So that brings me to toothpaste and the products that we should use to brush. In the past, I've used baking soda mixed with hydrogen peroxide. I know so many of the whitening toothpaste have hydrogen peroxide in it. So what might be some of your recommendations there in terms of what we should be using to clean the teeth?
Honestly, the best thing that works for cleaning the teeth is electric toothbrushes. Because you're getting rid of the stains, because we're drinking coffee every day, if you're having a glass of red wine. For me, I'm Indian, so we have turmeric all the time. So that definitely stains. So the electric toothbrush works really, really, really well because it removes all those stains for you. The other thing that I would say, my favorite toothpaste is actually Boka, Boka. It has hydroxynanoapatite in it, which helps remineralize the tooth structure. So that's a toothpaste that I like to use in order to brush my teeth. And, they have a whitening one in there. The whitening actually comes from silica particles. So like you were saying, baking soda, And the peroxide, it is an activator, but you can actually, it's the silica particles and the actual brushing that it's going to actually remove all the stain. So that's what I would use. The reason with baking soda, you can use it for a period of time, but sometimes what I find is that the teeth become yellower over time because it makes them porous. So that's why I like the electric toothbrush. You're removing all the stains. You're using the Boca, which has a hydroxy nanoapatite in it, which helps remineralize that tooth structure so it's not porous anymore. So that would be the reason. Thanks for letting me geek out on that. By the way.
Totally.
I appreciate it.
Into it.
I noticed you didn't mention any fluoride either.
You don't need it because the hydroxy nanoapatite is going to do the job. It's like, why add another thing that you don't need? And it's, again, least toxic, gets the job done, and it's efficient.
So I would guess you're probably opposed to fluorinated waters as well?
Florida, I don't think we need it. And more, the fluoridation becomes a real big issue when you're young and then also when you're older too, because of the way it's stored in the body. And also we're getting fluoride from so many other things, like fruit juices, even like natural organic stuff has fluoride in it, right? And it's the additive effect of fluoride that's an issue. If I just looked at fluoride by itself, like the dosage of it, 1 part per million, it's probably not going to do much. But the reason why fluoride is a concern is that we're not just getting it from the water, we're getting it from, our foods, we're getting it, if you're opening a can of something, it's going to have fluoride in it. If you drink, orange juice, it's going to have fluoride in it. So it's that additive effect. And that additive effect on top of where we are at this point in time, evolutionarily, 100 years ago, we probably didn't have as many toxins as we do now in our bodies. Now, because of the food chain, now because of the environmental aspect, now because of all these things that have added, and also there's so many ingredients in everything, right? Not just, a toothpaste or just water or, even fruit juices or anything. It's got like 10 ingredients in it, not like 5, the ones that we want to be able to count on our hands. And so all those additive effects is really what wears our livers out and our kidneys, and there are detoxification mechanisms. So that's why I'm not a big fan of fluoride. If you don't need it, why use it? I just, it just kind of defeats the purpose, right?
Right. What about fruit juices? I mean, you mentioned fruit juices a couple times there. I would think that they would be somewhat detrimental to the oral cavity just because of the sugars.
You're absolutely right. And they are. Fruit juices, especially orange juice, is acidic. That is horrific for it will cause cavities. I always recommend, even apple juice has a ton of sugar in it. We don't want that either. Even grapefruit, we know that it's good for us, but still it's acidic. And so anything that's acidic for the oral cavity is going to cause it's going to cause cavities basically. And what I would recommend is, if juices are great, so please have them, but please drink it through a straw. Mm-hmm. It doesn't touch your teeth. You're getting the good benefits of it. And the other common one that I always hear is lemon water, right? Lemon water is so great Ayurvedically, so good for you. And lemon water is amazing for our bodies because it actually helps alkalize the pH, right? But in the teeth, they're horrific. Same thing with apple cider vinegar. So I always tell patients, be careful. And with lemon water, just drink it through a straw. It doesn't touch your teeth. It'll work great. Same thing with apple cider vinegar. Drink it through a straw. It doesn't touch your teeth, and you'll still get the whole body benefits. So we just want to apply the right principles with the right environment.
Yeah, I never thought of that. I try to have a daily habit of drinking just a little bit of either lime or lemon juice with some, pink sea salt in water is kind of a boost to, the liver and some of the other benefits that you can get from it. But I'll have to start drinking it from a straw now. Yeah.
And drink it first thing in the morning. Instead of sipping it like a tea, that's, again, that constant exposure drops the pH and causes the cavities. So have it in the morning. It's great. I mean, it's a great thing to be able to do, right? But just have it in the morning through a straw. Again, if you added apple cider vinegar or whatnot, just first thing in the morning through a straw and you're set for the day. And also on an empty stomach, it's fantastic for the body because it's just going to absorb it all.
Yeah, so if I'm doing it first thing in the morning, and I tend to just down the whole glass, I don't drink it slowly, would it be better just to down it quickly than to sit there and sip it through a straw?
Yep. Well, I would say if you're going to, that one is a tricky one. Drink it through a straw.
Okay.
Yeah, one shot, drink it through a straw, down the whole thing, but drink it through a straw. That is going to be I'm not a big risk taker in life. So I feel like I like to have predictability. And so if you drink this straw, there's no even chance of it causing any sort of cavities or anything like that. If you drink it, the pH is dropped for 20 minutes. And that continuous exposure, you just never know if you got something else going on, or, maybe you're stuffed up one day and you can't breathe really well because you're in Portland and, it rains or whatnot, or pollen or something like that. And then you end up mouth breathing for the rest of the day. That acid is going to be amplified so much more.
Or you move into a new house and the previous owners had cats and you're allergic to cats. So, yeah, I'm a little clogged up right now.
Corbin's a new house owner.
Yep.
Congratulations.
I'm a new house. Yep. This is the new background and everything. It's going to get filled with a lot more stuff, but temporarily just a wall.
Congratulations.
Thank you. As a mentor and a leader, what's the most important lesson you teach other dental professionals?
That is actually a really good question. And I feel like being in the dental industry and somebody who has been holistic, who's been questioned, mocked, and so many other ways. What I always, tell, when I coach other dentists and hygienists is be open, right? They always think that what they think is right and it's the only way, and it's never the only way. There's always a solution. And, I honestly believe that human beings are smart. They want to give back to others. They're good people, and they're solution oriented. So somebody else may have thought of a different thing that you might not have thought of. So be open, listen, and see what somebody else has to teach you. I feel like don't be a know-it-all, I guess is what I'm saying.
I think that's great advice. And I also think it's really cool that you use cold lasers. Not a lot of people know about that, and not a lot of people utilize that, but if that's in your field of practice, that's really, really cool, and it's really groundbreaking. So
thank you.
You're welcome.
So you also do quite a bit of nonprofit work, particularly back in India. Tell us a little bit about that. What inspired it, and how has it shaped your approach to dentistry?
So the nonprofit work is actually really cool because I was actually born in a little village in India. So I was born in my own house. My mom was milking the cow. And so we have trees in the front, trees in the back, and trees on the sides. And so, I was 5 years old when I immigrated to the US. And then I went back to India for boarding school because I wanted to learn a language and, wanted to learn a couple more things and things like that. So I have a connection to India for sure. And when I got out of dental school, I was really, kind of figuring out my path. So I did go through some training, which was all about being a better leader, being a better person in the world. And I was looking at what would be something that I can leave behind. I don't have children. It's something that, I consciously chose. And I feel like the world is my children. And I feel like my purpose or my passion and maybe the thing that my legacy or my living legacy is going to be giving back to others, things that I didn't have and things that would help people live longer, rich, full, joyful lives. That's actually my motto. And so what I like to do is in India, we have a nonprofit. It took me 15 years to build, by the way. We have a nonprofit. We have a mobile dental van. We actually go out and reach out to children and women and parents and of the lower socioeconomic background. So basically, these usually are migrant workers. They're working in the fields, which is my exposure to dentistry. When I started doing my volunteer work, I was working with people in the field. So that was a nice connection. I really wanted these people they're not treated with dignity, and they're so in survival mode. They're really just focusing on where their next meal is coming from, that they're really not looking at how to optimize their health or to how to optimize their lives. And also the children, they miss so much school because they have dental issues, just kind of like in the US. And so my goal was to really impact them in a way that was going to touch, move, and inspire them to be better individuals and give them education, because it breaks that cycle of poverty. So the aspect of it is it starts from the dental world, it starts from dentistry, but the impact that I wanted to have is just not dentistry. It's overall health and also overall well-being. because, the reality is that everyone has to pay their bills. If the children can go to school, they can gain a trade or a tool, which allows them to work in society, maybe make better income, lift their families up, and be better individuals in the world, and be able to not be in that cycle of survival, but to be able to thrive. And that for me is very touching. So those were so many different aspects of starting with a dental nonprofit. And I also feel like dentistry is a profession that found me. I mean, I was going to be a neurosurgeon, right? Like, it was a completely different experience. And just really, I just feel like it's my purpose. There's no like way to say around it, or like, it's just my purpose. It's a calling. Sometimes we're guided to or pushed in a direction. And this is what came out of it. And when I was doing my community project, I wanted to give back in a way that was well rooted, something that felt really good to me, and just wanted to give back in the world. So I'm proud to say we've served 150,000 people in India in 3,000 villages. Wow. This is our 6th year going forward. And I want to share the story about, I have a team in India who's just phenomenal. They made this storybook for children. I just love it. It's like, the tooth fairy visits Artie, and in that story, they teach the children about toothaches. And then from toothaches, how should you brush and floss, and then after that, what are good foods, what are bad foods, so that they learn through education. And really in a fun way that's really pleasing for them. And not only do the children learn, but the parents learn too. And in that story, we also talk about how to prevent oral cancer, because oral cancer is really big in India, especially among the migrant workers, because they have to curb their hunger. So they have the tobacco. So that if they chew the tobacco, it makes them not hungry, and they don't have to worry about food, and they can save money. So, we went through like about how good foods are protein-rich foods that can keep you fuller longer, allow you to do more work instead of the tobacco. And also we have tobacco prevention programs that we've implemented working with the government of India. And it's just been life-changing, like from one thing to another. It's a beautiful gift that's, given me so much. And I'm proud of the organization that I work with. I'm proud of the team in India. And we're just so proud to be able to have served 150,000 people. And in 3,000 villages in 6 years, it feels really great. And our goal is to continue to grow that through the next 5 years. We're actually going to double the numbers, which is really exciting.
And what's the name of the nonprofit?
It's actually, the organization I work with is called America India Foundation. And the reason I work with that organization, so we created a special Dr. Nami's dental hygiene camp and dentistry camp. We have a mobile dental van that goes from village to village to village. And then we also go into the schools and we do prevention programs. We do needed dentistry prevention, hygiene cleanups and things like that. Also, if somebody needed any sort of work, we're able to do the dentistry. And then also if we find cancers or something like that, we're able to help diagnose and also get treatment through other hospitals and things like that. So the nonprofit, it doesn't really have a name except Dr. Nami's, I guess, dental hygiene camp, but it's the organization that I have hired is called American India Foundation. And I like them because they're a great organization to work with, and they actually work with the government of India, so that for every dollar that I spend, we're getting a better reach. And that's why we're able to get so many people, is because they're using the infrastructure and the Indian government that's already there. We're amplifying it. We're giving them more resources, and we're getting them to go deeper and reach further and focus on prevention, focus on diabetes prevention, which is huge in India as well, and heart attack prevention, which is huge in India as well because of the foods they eat. So it's been an organization that we've been able to do a lot more versus me creating a building and, spending all these resources, right? Yeah. These resources go a lot further because we're able to actually partner with the government of India and be able to, give them resources to be able to go further. So that's been really fun.
That is really awesome. Thanks for doing that.
Oh, thank you.
Yeah, it's amazing. How do you see green dentistry evolving in the next decade?
Green dentistry is going to be what I see should be very normal. There should be no regular dentists anymore. It should be holistic practices, data-driven, patient-centered, prevention-focused practices is really what we should be looking at. And the reason that I've designed courses for dentists and hygienists, and I coach them and teach them because that's really, again, my, legacy in the world is going to be teaching other people to do what I do because it's needed. It's the time is now. We're a health-centered society. And I feel like a big shift happened after COVID. We really went from a consumer society to really start looking at things more, looking at prevention more, looking at holistic aspects more, because, and that was a really great mindset shift. And I'm really excited about that. And I want the dental industry to meet that demand. Is that now patients are seeking it. Now let's have that dentist, level up so that they're doing things properly. And it's not just, I don't place mercury in the mouth, but let's look at the vitamin D issues. Let's look at the sleep apnea issues. Let's look at the root causes of these problems so we can address it. And that really should be, dentists it's a doctorate degree. Why should you operate differently than a doctor? And a doctor really, and also a regular doctor really needs to be a functional doctor, in which they're looking at root causes and really not symptoms, but really how do we fix your lifestyle so that it's more sustainable?
So do you have any specific advice for anyone looking to incorporate holistic or sustainable practices into their dental routine or their career?
Absolutely. So I have a bunch of courses that I did for patients and dentists and hygienists. You can go to sfdentist.com or drnamipatel.com, and they're listed there. So it's a great way to learn. I have a lot of videos. I have a lot of blogs, depending on what topic that might interest you, whether it's sleep apnea or whether it's dry mouth or whether it's a tongue tie or breastfeeding or pregnancy. There's a lot of information out there that you can just start looking at. And I always like to leave with 3 things you can do right off the bat, right? 3 is an easy number for us to feel comfortable with. It's things that we can implement and things that, feel easy. For example, hydrate. Start first thing in the morning, 16 ounces first thing in the morning, that sets you up for a win. Again, mouth taping at night before going to bed. That is a huge game changer for patients. Scraping your tongue. Our body detoxifies through our tongue, so scrape that tongue. That really gets rid of all the toxins. It really gets through all the bacteria. So those would be some simple things that I would recommend to start off with. Obviously, you've heard everyone say floss and brush your teeth. You don't need to hear that anymore. But let's start thinking more about hydration. And also, hey, before you go to bed, you can put coconut oil on your gums, rub it on your gums, or sesame oil so your mouth is not dry, especially if your nose is congested, if you're in a new house. So, or if you're, it's just raining outside, or if you're sick or whatnot. So, but just simple things you can start doing right off the bat.
So I'm going to jump to the question that we ask of all of our guests. What are you doing personally to age well?
Wow. Well, the most important I would say is meditation. I'm a big believer in meditation. I, really call forth, again, the purpose is really important. That meditation, that mindset is really important. And then I do the mindset, I do the visualization about how I'm going to make an impact in the world. Physically, what I do, hydration in the morning is really fantastic. The other thing I do is I do intermittent fasting. So I eat one day, I fast one day. I eat one day, I fast one day. So instead of the 16 to 8, I do like a 36-hour fast, which is great because it really gives my body enough time to be able to repair any sort of damage or deal with the toxins and things like that. So I feel like that has been a huge game changer. Mood levels, body, just everything, and hormones too. Did you know men have menopause?
Yep.
I've heard that.
Right. So the other thing is also making sure getting out in the sun, getting that vitamin D3, that is huge. Really making sure that, setting the proper foundation. So I would say hydrate, intermittent fast, get that vitamin D3. Those are really big things for anti-aging. And then the other thing I do that I love to do is yoga in the heat. So earlier I mentioned that, our body detoxifies in heat. So if you do yoga, hot yoga, it's fantastic. You've got 2 birds in 1 stone. So my personal yoga that I really like to do is, it's a power yoga with weights. So you're in the heat, you're using weights, and you're getting cardio and you're getting stretches all at the same time. In that 1 hour, I'm so efficient because I'm hitting so many multiple stones. My bone density has doubled since the time I've started doing that, which is awesome.
Where can our viewers and listeners find your book and learn more about you and green dentistry? Is there a webpage, social media? How can they reach out to you?
Absolutely. So the easiest way is the webpage. It's Dr. and then Nammy, Nammy, Patel.com. And that's my website. There's a lot of information on there. And then also you can go to my practice website, which is SF as in San Francisco, Green, dentist.com. And there's a lot of information out there. We always say reach out to us, and we're happy to help in any way. We do telehealth. We're able to help, and we in fact have patients in Malaysia, London, Switzerland, everywhere. So it's really great. We actually have a few patients in Portland. So it's really nice to be able to serve the world, because we're a global society now. And the other thing I would say is I'm not as big on social media as I should be, but I guess call me old school. I don't know. I'm still adapting to the social media stuff, but I like to give you a lot of good information. So schedule a call. Telehealth is great. And I'll be able to hone in and help you with customized care right at that point in time. So
that's awesome. And we will include links to all those web pages, to your book, and to a couple of those products that you mentioned as well in the description notes. But this has just been an enlightening conversation for me. I've learned so much about my oral care, and I thought I've been doing pretty good. And there's quite a few things I need to change a little bit, but that's part of life, right? To learn new things and change our habits so that we get better and overall we just age well. And so I want to thank you for the work you're doing both here and in educating other dentists. Hopefully maybe we can, I would love to see the word green not have to be used anywhere anymore other than the color of a wall or something like that. We have to talk about, we have to go green. Well, let's get everything green and then we don't have to use that word. And so I just thank you for kind of educating people on that, and just encourage you to keep doing what you're doing and keep aging well.
Well, thank you. It's been my pleasure. Thank you so much.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.